and we are at a tipping point. I am hopeful and positive about where we've got enough, where we have vaccine to protect residents and staff, and that I'm hopeful that the outbreaks that we're starting to see now that have slowed down, but we're stopping that second generation. So it's rates in our community that reflect in our schools, that reflect in our long-term care homes and in our workplaces. So what we need to do is bring those down. The challenges we face now, which are different and have moved from November, are that we're seeing more widespread in more communities transmission in the interior and the north. And it is a challenge again about making sure that we keep our gatherings small. It's the same things that are leading to transmission events that we saw in the Lower Mainland a few months ago. So we know what we need to do, and now it's come home in a lot more communities, and so we need to take a step back and go back to our basics, stop the spread.
Alberta's announced today that they have finished vaccinating residents and staff in long-term care, and I was hoping we could get an update on just how far along we are in BC.
Yeah, so we are farther along in some places than others. The Lower Mainland had the amount of vaccine earlier on, and we're well on our way to completing all long-term care homes. It's in the 80% or higher for both Fraser Health and Vancouver Coastal for residents and homes in the Lower Mainland. It took longer and more challenging with in the North Interior and Island Health, where care homes are more spread out in different communities, and the vaccine has been coming in smaller amounts. But the target is to complete all care homes by the end of this week, next week, depending on when vaccine arrives this week.
As it relates to healthcare facilities and long-term care, obviously that's where the bulk of the cases have happened, and then obviously certainly the serious and deaths. My question to either one is, does the ministry have any idea how the virus is getting into these long-term and healthcare facilities, if not through the staff bringing it in? And is there any solution or solutions as far as remedying how how the virus is getting into healthcare and long-term senior housing accommodations?
Yeah, so we know this virus is transmitted through people, and we've known that from the very beginning. The main way it is transmitted is through close contact with somebody who's infected with it. And we know from our work, but also from work around the world, that the single biggest risk factor for an outbreak in a care home is the level of spread and the level of virus circulating in the community. And we know that that's what we see here as well. So yes, it is staff, it is people who are back and forth within the long-term care home who unwittingly bring it in with them. And it is such a challenge. It has to do with all kinds of factors, whether people are minimizing their symptoms, not recognizing them, not being screened adequately in some cases, the challenges that we have with staffing, with access to PPE, with people using their PPE, the challenge with caring for people in long-term care, many of whom have dementia and other illnesses, where it's very challenging to maintain your PPE when you're helping people with personal things like bathing and feeding. So it is a combination of factors, and it is absolutely the most challenging thing that we've had to deal with in this pandemic, both here in BC and around the world.
And the issue of community transmission has changed through the pandemic, but since we took measures in the middle of March to limit visits, except for essential visits in that time, and then replace that with the policy in July, essentially the people coming in and out of long-term care are the staff. And so the source of transmission is that. We saw that in March and extensively reported on it then. You'll recall the movement of virus from people connected to travel to Washington State that showed up in our care homes was an indication of that. It's the reason for the single site order and all of the efforts on PPE and all of the other efforts on infection control. And we also have seen in more recent months the dramatic increase in transmission in long-term care linked to this season of the year, October, November, December, now January, where there's significantly more COVID-19 in communities, and that's been reflected in transmission into care homes. But it's a little different in acute care, where there's more movement of, obviously, movement of patients in and out and so on, how outbreaks take place, or even in some acute care that has to do with rehabilitation, we've seen the same thing. But the primary source of it in long-term care is, of course, staff, and that's why such extraordinary efforts have been put in place and why the pressure on staff, on PPE and on everything else is so high, and why it's so important that we do the work that we've done. I think in Fraser Health and Vancouver Coastal Health, talking about the immunization, that all of our care homes in those two health authorities now have received vaccine, and that's important because that's the primary source of transmission. But we see it everywhere in the province, and so that's why we've moved so quickly on that. I just want to say finally, because I think a lot of people out there are rightly concerned. It's been a long time since we've had any kind of regular visiting in long-term care. We have essential visitors, and we made changes a couple of weeks ago to clarify the rules around essential visitors. Since July, we've had other visitors, and one of the reasons why we're anxious for both doses to be provided to residents and to staff in long-term care is to try and work after that happens, which is will be 35 to 42 days from now, on what we can do to make life better in long-term care and allow more free, more visits and more social activity in long-term care than's been taking place, because COVID-19 is not the only issue in long-term care. We all know this, and we want to and are concerned about the quality of life of everybody.
Richard Zussman, Global News.
The issue you just raised there, Minister Dix, is the exact issue I'd like to ask on here. So let's start with one piece of that. You mentioned essential visitors. The senior advocate says that based on the approximations that the province has given, you're forecasting that only about 23% of long-term care residents will have an essential visitor that gets the vaccination. Why is that number so low? And can there be a policy to ensure that every person in long-term care has an essential visitor?
Yeah, so I think we need to understand the visitation that goes on in long-term care, and sadly, and this is data that the seniors representative has put out, it's only about 47% of people, residents in long-term care, have regular visits. And the essential visitors has been a challenging thing. It is there is a process in place to try and make that easier for people, and the default, we believe, should be that every person, every resident who has a person who can care for them should have a designated essential visitor. But that has been a challenge to operationalize. But we are providing immunization to those essential visitors who have been designated. I don't have the exact number, but there's it was estimated by my colleagues in the health authorities from their work with care homes to be about 8,000 additional people to the 30,000 that are in care.
Just to speak to that, Richard, and I was partly working with the seniors advocate and others that we made the changes to visitor guidelines that we've made a number of times since the beginning of the pandemic. In May, we made some changes that particularly affected acute care and particularly affected people living with disabilities. And we made some changes to clarify the rules just recently. So I just want to be clear to everybody about the term essential visits is defined, and you can provide in the document which is available at the Ministry of Health websites the definition of an essential visit. But of course, everyone and every family and every person needs visits. And even though some are defined as essential and some are social, they're all important and they're all, in a certain sense, essential, just as we often get into the discussion with the term of essential with respect to workers or types of people working in society. And so one of our priorities right now in the first phase of our vaccination campaign effort is to provide, of course, to long-term care workers, to protect long-term care residents to protect long-term care residents, essential visitors to protect long-term care residents. And once we've finished that, I think we'll have gone some significant way in making long-term care homes safer. It is beyond dispute that a broader view of visits than we've taken right now would have led to more infection in long-term care. That's just a fact, and it's the reason why these extraordinarily difficult decisions, some of the most decisions I've been most reluctant to be involved in, all of us are, have been made. It's to ensure to the maximum degree possible that we limit transmission of COVID-19 in long-term care because of its impact on people in long-term care. So I think it's fair to say some changes have been made. We're giving focus to those people who have defined essential visits. We also have a process by which people can appeal if they don't agree with the decision about whether a visit is essential. And these are the changes we've made now, and we back that up with adding essential visitors to our immunization program. So all of that is a pretty strong response, and the whole purpose of which is to keep people safe in long-term care, but hopefully earlier than other changes we might make, also to allow more social activity for people in long-term care.
Richard, do you have a follow-up?
As we close in on everyone living in long-term care being vaccinated, when will those restrictions start being eased? I think Minister Dix just alluded potentially to having to wait that entire second dose period, which in some cases could be longer than 35 days as we sort of catch up to get to 100%. And once we get to that point, what will visitations look like? Is there a way that loved ones will be able to hold their loved ones in long-term care? How quickly do you believe something like that could happen?
Yeah, we're going to be following the data, looking at what's happening. We know that a number of outbreaks were underway as the immunization started, and it takes another 2 incubation periods before we get through that first phase of the outbreaks in some of the facilities. And then after the second dose, we know that maximal protection is about 7 days after dose 2. So that's what we're aiming for. We are going to be watching very carefully because we know that some people are still getting sick with COVID-19 even after being immunized because they were exposed before the vaccine effect could have that protective effect. So yes, we're looking at into the latter part of March. But we are making plans for how we can get people safely together as soon as we can in care homes.
If you could further elaborate on the whole rapid testing thing in care homes, are you opposed to private care operators taking it upon themselves to use those rapid tests? If you could share them with them or let them have their own programs, because I understand some of them are already doing that.
I'm not opposed to anything that helps prevent transmission in care homes, of course not. And we do have some pilot projects. What the pilot projects have shown is what we thought all along. These are very resource intensive, and it's not the cost of the test. It's the time and the medical people that need to be there to monitor the tests and look at how they're being done and how they're being performed on site. So we know that it takes at least 3 people, that it's about 15 minutes per person per day, and you can do multiple sets of them at a time, but they all have to be timed specifically, and you have to make sure you know which one belongs to whom. So it's not a simple thing to do, and it is something that they have been in the pilots been doing once a week, and even that was very challenging. And it cannot take the place of the medical screening questions that have to actively be done when you check in for work, and the screening that needs to be done on all residents twice a day. It cannot take the place of the importance of using all of the infection prevention and control measures that we know work within care homes. So it is a tool that takes a lot of energy and a lot of human resource time, and it is the opinion of most of my colleagues across the country and here in BC that the resources that we have that are scarce around supporting infection prevention and control in long-term care is most often better spent on other measures. But I certainly, if there are resources that private companies have that they want to use for that, it is one tool that can augment the other important measures that continue to need to take place in long-term care as well.